Welcome back. We'll start with a new topic, organization of clinics and camps. What is clinic? The word clinic refers to a place where outdoor patients come to physicians and member of health team for treatment and follow-up treatment. According to another concept, clinic is the place where the patient who cannot move about are OT institutionalized come for checkup and treatment. Clinic means a place where they will come for the follow-up treatment and just for the health checkup to the and to consult certain physicians and the health team members. What are the purpose and importance of clinics? Primary healthcare facility to vulnerable segment of society. There will be backward class people in the society or the community. To take care of them, we need primary health care. Easy reach, no need of transportation for patients. Okay, it is available in the community itself, so no need transportation. There will be diagnostic facilities, free or minimum cost of treatment because it is involving in the government sector itself. Counseling and health awareness, services of specialist doctors or clinicians. Special doctors will be available for the care of, and the referral services. If the patient need any further care or treatment, then this primary health care will refer the patient to the higher hospital or the community health center. Choice for alternative therapies. You can go through any other therapies and it which will be referred by this primary health care. So what are the features of good clinic? It is planned and follows the timetable. As far as possible, liberating the patients from the compulsion of pre-registration. There is no need of any pre-registration. Physicians and members of health team should be specialists, one and skilled in their work and sufficient in numbers. Okay. All the healthcare members should be specialists and they should be skilled and they should be sufficient in number for the care. Proper arrangement of place, equipment, furniture, medicines, toilet, drinking water to be done in this clinic. Working hours of the clinic is more than the usual timings of health centers. There is no particular time period, but there is timetable. They can work more than that also. Behavior of medical staff should be satisfactory while giving the diagnosis, treatment, and the answers to the queries of the patient. They should maintain good nurse-patient relationship with the whoever comes, the family members or the patient. Facility for follow-up treatment should be available after the treatment given in the clinic. There should be follow-up treatment after the treatment of any disease. Requirement of the community should be kept in mind while setting up the clinic. Whatever, which clinic is needed or what is the condition of the community, everything should be in mind while building any clinic. Arrangement should be made for effective health education. Health education to be given to the all the community in particular period of time. What are the places for clinic? Subcenters, there we can give subcenter, PHC, CHC, that are primary health centers and the community health centers, hospitals, low income group colonies, slums, bus stands, school fairs, NGO campus, places and similar communities. So these are the places where we can build a clinic. What are the functions of clinic? Medical checkup, follow-up treatment, diagnostic services at small level itself, the medical help for the needy including the medications, counseling or health education, and referral services. These are the main functions of the clinic. What are the types of clinic? There are 4 groups. First, general clinic. These are arranged for the examination, diagnosis, and treatment of all minor ailment. Okay, all the minor ailment will be treated, diagnosed, and examined here. Thus, many health activities can be conducted through these clinics. Immunization clinic, X-ray clinic, dental clinic, etc. are the examples here. Second one is maternal and child health clinics. Here, antenatal clinic, postnatal clinic, under 5 clinic, family planning clinic, child guidance clinic, and reproductive and child health clinic. So these are the clinic which comes under the maternal and child health clinics. Specialty clinics, medical and counseling services for certain specific disorders are provided through these clinics. Specialist doctors and nurses are essential for the conducting these clinics. When it comes to the specialty, okay, there should be availability of specialist doctor or nurses to take care of these people. Example like diabetic clinics, STD clinic, STD means sexually transmitted disease clinic, TB clinic, tuberculosis clinic, nutrition clinic, etc. Okay, these are the example for specialty clinics. What is the role of community health nursing clinic? Assessing the health status of the patient, okay, before referring to the patient or before admission and before referring to the doctors, you will assess the health status of the patient. Provide nursing services to the patient, educating the patient for improving the health and skillful adjustment. Okay, here you will give health education to the patient regarding the health and skillful adjustment. Providing special knowledge, skill, and technique as per the health needs of the patient. Related to the needs, whatever the condition patient is having, based on that, you will give special knowledge, skills, and the technique to the and treatment to the patient. You will assist the doctor and selecting the place for the clinic, which place is available and it is good for the clinic, that you will be selecting. And role of community health nurse, taking care of the availability of medicines, equipment, other resources for the clinic, helping the diagnostic investigations, whatever investigation the patient should undergo, you will help there, you will give health education, handing over the responsibility to health workers for conducting the clinic, record maintenance, arranging all the essentials for the clinic. These are the roles of CHN, the community health nurse. What is health camp? These are organized to provide need-based specialized services to a defined population. Okay, certain population will be having a certain condition, like if the malaria prevalent area or dental clinic, dental related any problem is there, and again blindness related, vision related. So like this camp you can arrange. What are the indications? To provide health services such as diagnostic, curative, family planning, referral, and immunizations. Okay, these are the main goal here. To inform, motivate, and guide the people in health action. To conduct orientation and training for public. To impart knowledge about various measures to promote health and identify there. Here, main thing you are doing in the health camp is you will assess the patient. You will give certain medications if they need, then you will refer the patient to the hospital, and you will give health education to the patient so that they will know what to do when something happens, and when to meet the doctors. What are the types of health camps? Service camps and the education and training camps. Service camps for specialized services such as camps to diagnose eye pathology and perform cataract surgeries. So this will be done by the ophthalmology departments. They will take care of this health camp, and you will be assisting them. Antenatal camps to offer with advice, guidance, treat or refer complicated cases. This will be done by the obstetric and gynecology department, and you will assist there to do antenatal care and to advise the patient and guide them. Family planning camps for tubal ligation and vasectomy are organized to increase couple protection rate. So couple protection rate means here you are decreasing or reducing the birth of the child by conducting family planning camps, and here you will do the tubal ligation and the vasectomy of the patient. Education and training camps to provide in-service training and orientation to village leaders such as community health workers, volunteer, DAIs, and informal leaders, etc. Okay. Here you will educate certain members and train these people to conduct certain services to the community. So what are the equipment required here? Diagnostic equipment for hemoglobin, urine testing, BP apparatus, temperature tree, etc. These are the main equipment. And sterilized gloves, linen, gown, caps, Macintosh, etc. Cleaning articles such as lotion, iodine, spirit, cotton, gauze, soap, towel, and shaving set. Operation table, extra bed and linen, medicines and injections. So these are the equipment required in the clinics and the camps. Record consent forms, etc. Spotlight, torch with cells, registers, suturing material such as catgut, suture, cotton threads, needle holder, and suturing needles. These are the main articles you will need in the camps and clinics. What are the special equipment? For family planning, camp instrument for pelvic examination, that is done by the OBG department. For eye camp, you'll need ophthalmoscope, drugs, and Snellen's chart. For educational camps, you will need a certain like educational and motivational material, and seating arrangement and audiovisual aids. So, what are the planning before, during, and after camp? The steps: the CHN must, that is community health nurse, must actively participate in planning and organizing the camp, securely, adequately publicity of the camp. So first you will give a publicity to the, you will plan and organize a camp, and then you will give the publicity to the community. Procuring and arranging all the equipment such as table, chair, linen, teaching material, supplies as required for the camp. So what are instrument or a special instrument required for the camp, you will arrange it. Mobilizing all available community and other resources for the successful running of the camp. So where you are doing health camp, there you will mobilize all the community people to the same spot. Making adequate arrangements of supplies for sterilization or immunization if such services are to be provided. If you are doing the sterilization camp or the immunization camp, certain other arrangement can be done. Distribution of publicity material, that is SC and MCH. Organizing exhibition to display health messages at the venue of the camp according to the theme of the camp. So which theme or which camp you are conducting, based on that you will display certain messages and the charts. Involving school teachers, community leaders, and other voluntary workers for imparting knowledge, changing people's attitude, and developing desirable health practices. You will involve all the people like school teachers, community leaders, and voluntary workers for this work or clinic. Keeping the records about the community in hand. You should need a record. So what are the steps? Selection of participants. First you will select the participant. You will plan for the camp. Then you will decide on the content and the schedule, what content you are taking, and schedule it, timetable to be made. Conducting the camp. Then you will conduct it. You will follow up how it is done and evaluate it. Then you will record and report it. So that's what about the clinics and camps. We'll see in the next chapter. Thank you.